NACO kits, which is very important from exam point of view. They were updated in 2024, but still so many students have a doubt between the old and the new guidelines. What are the differences? We are going to discuss this very important topic in this video. Watch it till the end. Hello dear students, myself Dr. Maddineni Srinivas. Welcome back to my YouTube channel. So at the end, I am also going to cover one MCQ which was a PYQ asked in NEET PG. So let us begin the discussion without any further ado. So this is the update from 2024 which I am discussing now, and what is the reason for the changes in the NACO kits. So the first reason, most important one, is the raising antimicrobial resistance. So this was also INI MCQ which was asked, which mentioned which of the following is a sexually transmitted infection in which there is a lot of antimicrobial resistance nowadays which is observed. And what is the answer for that question? Yes, it is gonococcal infection, and that is the reason why the medication which targets Neisseria gonorrhea, that is Cefixime, the dosage has increased from 400 to 800 mg, right? And also the changes are done. It is mentioned standardized pill counts is also there to improve the compliance of the patient. This change was done, and now there is a new kit altogether to target the urethral discharge syndrome, and also we will see what is the scrotal syndrome and where is it used, where is it covered. So now we are going to see one by one the kits and the contents of them and what are the differences. So kit number 1, which is grey colored kit, so it is used in the urethritis management. And what are the medications? To cover the gonococcus, we have the Cefixime, and to cover the non-gonococcal causes for urethritis, we have the Azithromycin. What is the difference? Is only difference is the dosage of the Cefixime now is 800 milligrams instead of the 400 mg. That is the one difference. Apart from this, the mention of the PT, that is presumptive treatment for the high risk behavior individuals, is mentioned in the kit number 1. So what is meaning of the high risk behavior? Those who are commercial sex workers or those who are MSM, that is male sex male, these individuals, even if they do not have the signs or symptoms, that is there is no syndrome seen in the person, but still we are going to presumptively treat them with the kit number 1. This is one change. And also those who are having painful scrotal swelling, they are going to get the kit number 1. So these are the important points to remember, right? And also you can see this was a previous INI MCQ. What is the sexually transmitted infection in which majority of the resistance is observed against the antimicrobial agents? And what is the answer for that? It is gonococcal infection, and that is the reason why the dosage of the Cefixime has been increased from 400 to 800 mg. This was INICET MCQ. Now coming to the kit number 2, which is green colored, and it is used in the vaginitis, vaginal discharge syndrome. Remember dear students, the vaginal discharge, it could be because of the discharge coming from the vagina. It could also be because of the discharge coming from the cervix, right? If the vaginal discharge is because of cervicitis, the patient is going to get the kit number 1. But if the vaginal discharge is coming from the vagina, then the treatment will be with kit number 2, which will consist of tablet secnidazole 200 milligrams and tablet fluconazole 150 mg as a single dose. So in the latest guidelines, there is no any change, but the only difference is that terminology has been little bit refined, like what I have explained. Kit number 1, also there can be vaginal discharge, but it is because of the cervicitis, right? Kit number 3 and 4 are basically the kits used in the genital ulcer disease. Apart from the herpes simplex viral infection, the most important cause of the genital ulcer apart from herpes in India are, one is syphilis and the other one is chancroid. So kit number 3 and 4 are basically going to cover syphilis and chancroid. Kit number 3 is going to consist of an injectable, which is benzathine penicillin, which will cover the treponema pallidum causing the syphilis, whereas azithromycin is going to take care of the chancroid. So we have these two medications, benzathine penicillin and azithromycin. So in the latest updates, there is no any change, but there is only mention of the syringes and the gauze of the needle which are available, and the sterile water in the kit, right? Next is kit number 4. For those who are having allergy to penicillin, we cannot use the kit number 3 because anaphylaxis may lead to death of the patient. So in them, penicillin will be replaced by the tablet doxycycline, which has to be given for a period of previously 15 days was what is mentioned, but now it is changed to 2 weeks, exactly 14 days, 100 mg BD for 2 weeks, right? And apart from this, azithromycin is going to be the same in the old and also in the new guidelines, right? And the next kit is kit number 5, which is red colored kit used in the herpetic genitals, that is herpes genitals, right? Here there is no any change. Okay, it is just mentioned that there are 21 tablets. Obviously acyclovir 400 mg, if it is given TID for a period of 7 days, 7 3s are 21 tablets will be there, right? Next is kit number 6 used in the lower abdominal pain, that is pelvic inflammatory disease. Yellow dirty fellow, lower abdominal pain. That is how you can remember the kit number and the usage of it. It is consisted of the same 3 medications. Now also it is going to be the same medication except for the change in the dosage of Cefixime. Like I have told you, wherever Cefixime is there, instead of 400 mg, 800 mg is used because of the increased antimicrobial resistance. So here it is Cefixime increased to 800 mg. Apart from this, the rest of the others are same. That there is only mention of the tablet or capsules numbers. So metronidazole 400 mg BD for a period of 2 weeks, doxycycline 100 mg BD for a period of 2 weeks. Okay, kit number 7. Now here there is one very important difference. It is black color kit used in the patients of inguinal bubo, especially LGV. So previously there was this azithromycin which used to cover the chancroid producing the bubo, and also doxycycline was there. But now what happened is the doxycycline is present in the new kit, but azithromycin has been completely removed from the kit number 7. So this is one very important difference which you have to remember. And also the kit number 7, the other indications which have been added are the LGV proctitis. Okay, this is added in the kit number 7. So this point you have to remember, if the bubo is because of the LGV and if the proctitis is because of LGV, kit number 7 black colored kit consisting of the doxycycline 100 mg BD for a period of 3 weeks is going to be the treatment which will be used. Coming to last kit number 8, brown colored kit. So this is same as that of kit number 1. So the MSM, male sex male, or even the male penetrating the anus in the female, ultimately the same organisms causing urethritis are now going to produce anorectal discharge syndrome. So that is the reason why the medications are going to be almost the same. That is, if you see in the kit number 1, there was this Cefixime 800 mg, now it is 800 mg. It is same to cover the gonococcal component. Apart from this, instead of the kit number 1 which was having azithromycin, here we have doxycycline 100 mg, 100 mg BD for a period of 1 week. So in the kit number 1, we had azithromycin to cover the non-gonococcal causes of urethritis, that is most commonly chlamydia. So the same organism is going to produce the anorectal discharge syndrome. So here it is going to be treated not with azithromycin, but because it is very difficult to treat condition, so that's why doxycycline is replacing the azithromycin. Okay, and it's going to be given for a period of 1 week. So right, these are the changes which have been done, and quickly to summarize what are the important changes. So you can see the new guidelines provide more comprehensive categorization of the vaginal discharge syndrome into kit number 1, which comes under cervicitis and treated with grey colored kit, and kit number 2 vaginitis, where vaginal discharge is from the vagina itself and the treatment is going to be different altogether. So here you can see vaginal discharge syndrome for cervicitis, for vaginitis. Next is the new guidelines introduce painful scrotal swelling and also presumptive treatment for kit number 1, that is grey colored kit, and mentions LGV, that is lymphogranulovenereum proctitis, for kit number 7, and removal of medication kit number 7. Now azithromycin has been removed. Next, kit number 8, which is anorectal discharge syndrome. The color of the kit is very interesting. The anorectal discharge, how the color will be, the same is the color of the kit number 8. So it is very good that somehow we got the easy color to remember, kit number 8. So here it is annular discharge syndrome, and I hope you understood the concept behind what medications, why are those medications used in the kit number 1 almost similar, analogous to that, but kit number 8 is also having the same medications, right? And clinical terminology updation, like I have told you, LGV proctitis and inguinal bubo are covered under the kit number 7. Increase in the dosage, like I have told you, the Cefixime is increased to 800 mg to take care of the antimicrobial resistance, and this is the MCQ which I told you I will ask at the end. So try to guess what is the answer. Wife of a truck driver with multiple sexual partners presented to the Derma OPD with vaginal discharge and cervical erosion. So what will be the preferred STD kit color in this case? If you have thought that yes, vaginal discharge is there, so kit number 2 green colored kit will be used, then you are wrong. So we have already seen the change in the nomenclature of vaginal discharge. So if it is from the cervicitis, because of the cervicitis, then we are going to treat the patient with kit number 1, right? So here it is mentioned that there is cervical erosion. So why is this mentioned? Because whenever there is vaginal discharge, along with that if there is cervical erosion, then think of the possibility of cervicitis. This patient now requires a grey colored kit but not a green colored kit, right? I hope this is helpful and you have understood the kit colors, the contents, and what are the changes. So if this video is helpful, please do that like button, also do hype the video, and also do subscribe to this channel, and if you have any doubts you can ask in the comment section. I will try to reply them, and if you wish to join my Crack Derma DrMSD Telegram and WhatsApp groups and channels, the links are there in the description.